Hey, everybody, and welcome to another Migraine Mentors minicast. Well, I'm your host, Dr. Eric Reis, and I'm flying solo today. And I'm excited for this episode because I've been wanting to talk about this for quite some time. I feel like we've done a really good job over the last couple of months of talking about how to think, how to act, what to look for, and really how to approach treating migraine and complex migraine attacks. But one of the things we haven't really given you is like a play-by-play, step-by-step protocol on like how to go about finding treatment, getting treatment, and what you should expect for treatment. So today we're really going to give you a look under the hood and give you more information about what we do in the clinic at the Neural Connection for our office. We're going to talk about protocols. We're going to talk about just different ways that we help patients who are in similar situations as you are. And so I'm excited to get into this because this is something that I do every single day. I love what we get to do. I love that we get to help people. I currently have an amazing patient of mine who is quirky and funny in everything that you could ever ask for as a doc. And she's been struggling with chronic migraine attacks for the last 3 years. She is one of those people that goes through her triptan medications. She goes through 10 of them in the first 15 days of the month. And she just struggles and suffers and is just in an absolute horrible state for the rest of the month until she gets her next prescription. And so what's been cool with working with her is that she has a ton of visual issues that we've addressed. She's got a ton of structural issues with her neck that we've addressed. Her diet is horrible, and she knows that, and we know that, and we're making big progress on that. But she is on day 9 officially of her not having a headache or a migraine. And her pattern is like literally being in pain in some way, shape, or form every single day. And I haven't seen her in 3 or 4 days right now, and she's still doing well. So I get so excited about this stuff because I want to just give everybody everything that they can have to live the life that I know that you're meant to live. And so that's why I'm excited to do this episode. So without further ado, we'll get into it. These are like the top 5 things we do clinically in the office at the Neural Connection to help people who struggle with migraine and migraine attacks. The first and foremost thing that we do in the clinic inherently just makes a ton of sense is essentially something that you should expect to have with every doctor you see, which is a good exam. Now, we take this a step further by really making it an in-depth neurological and orthopedic exam. So we're looking at things like your neck, we're looking at trigger points, we're looking at range of motion, muscle tone, tension, we're doing orthopedic tests. But we're also doing a lot more than that. We're looking at like, can you keep your eyes parked on a steady target? Can you visually track that target? Can you judge depth or distance? Can you look at different targets when I have you test? And we quantify all of those things. We do an in-depth neurological examination, looking at palate elevation, reflexes, balance, stability. I mean, you name it, we're going through with it with our patients. Like our exam takes 90 minutes. And that includes a bit of a report of findings at the end, but it's all about getting data. So the first thing that you should be asking for from your doctors or from any new doctor or new provider that you go see is, what does the exam look like? Are you going to actually do like an in-depth neurological examination? Not just, oh, can you do range of motion? Can you look at my finger? Oh, can we look at a reflex for your knee? And then, oh, you're good to go. You're fine. It's like, no, there's so much more to the story than that. And you have to know that as an individual. So number one, you should be asking and demanding for an in-depth neurological and structural exam. That is bare minimum, in my opinion. The second thing we go through is we go through medications. We go through supplements. We go through like your diet, your nutrition. Like these are fundamental elements of managing and treating migraine attacks and migraine symptoms. There's just no other way about it, right? So I got to have the best neuro exam possible, but if I don't look at you metabolically, look at your gut microbiome, look at the foods you're eating, look at the foods that you're not eating as well. These are really important factors for controlling inflammation, looking at that inflammatory cascade we talk about all the time, and just understanding like what's going to prime you neurologically. So we go through medications, which a lot of times we catch people taking medications that were, meant to help them, but they're actually cross-interacting with other medications or even supplements that they're taking. And the same is true, right? So I have patients who take supplements, and unfortunately they cross-react with medications. An example of that is St. John's wort. St. John's wort is taken for people to help with like depression and anxiety, things like that. But it actually cross-interacts not only with birth control, but it cross-interacts with SSRIs. And that's not good, right? So supplements are not this like, panacea of like opportunity. Like you have to be careful with what you're taking and putting in your body and on your body. So we go through a big report of findings and list with that. And, we reference a bunch of different things to find these answers quickly. But when was the last time you like had your medications checked? When was the last time you had a doctor like go in depth to look at the supplements and the medications you're taking and make sure nothing's interacting? If you haven't done that in a while, now is a great time for you to do that. So you have to take a look under the hood and see what is actually going on a pharmacological and pharmacokinetic side of the story with that. So if those are the first two things, what I'll say is the third thing is us just kind of just doing an assessment of like, where are you at mentally, emotionally, spiritually? Like, what are your stressors look like during the day? And how does this all kind of play a role within itself? I mean, we all have stress in our life, right? And stress is not necessarily inherently a bad thing. You stress your body and your muscles when you go for a workout, and that's viewed as something very healthy, right? So that stress is important because it helps us grow and adapt and change and evolve and have more bandwidth. But too much stress is obviously a bad thing, right? If it's negating your sleep, if it's negating your quality of life, your friendships, your relationships, if it's just causing you way too much tension, or if you're in a relationship or you're in a job that is just sucking the life out of you, then that can be way too much stress and stress that's not benefiting you, right? So we do a really big inventory about what is currently stressing our patients, what is the biggest stressors for them, and is there anything that we can do to alleviate that? Now, people know you can take like adaptogens like ashwagandha to try and metabolically buffer stress. You can do different things from the gut and nutrition and diet to help people handle more stress, but that'll never take away like a job that you hate or a relationship that you're not happy with. And so we have real honest conversations with our patients about like, hey, what's going on? Like, what's realistic for you to change and adapt? And more importantly, do we need to bring any other providers into this conversation? If you're somebody who is dealing with mental health issues and you're not seeing a mental health provider, somebody who's doing psychiatry or psychology or both, then we find those people for our patients. And that's maybe viewed as a bad business model for us, but my goal is not to like get people to into the doors and keep them forever. My goal is to get them in, get them better, and in the most loving way possible. And every one of my patients has heard me say this, kick you out of our office, because you should be living your life and doing whatever you want to do with your life. You should not be spending any more time with us. Like, I think we're cool, but we're not that cool kind of thing, right? So we have no hesitation of kicking people out of the office or just collaborating and co-managing care with other doctors. And I love doing that because I learned so much, and I have learned so much with that. So if that's the first, second, and third thing, really the fourth thing is putting together like a treatment plan that is personalized for the patient in front of me, right? Like, I will never ever get a cookie cut approach. I just got off a call with a patient literally a half an hour ago, and she sent over some of these protocols that her occupational therapist gave her for her concussion and her migraine issues. Now, this is not a shot at occupational therapy or any profession, but the fact of the matter is, like, she just got a PDF and a sheet and said, hey, go do these and good luck. Like, I don't believe in that. Most of the patients also that come to our clinic have already done the cookie cut approaches and it hasn't worked for them. And so if this is you, know, one, that you're not alone, but then two, like, there's so much more out there. There's so many people who want to help you, us included. So, what we do is we are really keen and keenly focused on personalization. Like, what do you need? What is your brain? What is your body? What does your metabolic capacity look like? And what can we give you to help you update your software? That is the question that I'm always looking for an answer for. And that is the reason why people come to find us. I've seen people from all over the US and even outside of the US. And there's a reason they continue to come find us, is because we just do things differently. And that's so important. And if you're somebody who's struggling, you have to start asking those questions to get the answers you're looking for. Because the last thing that we really focus on in the clinic is bringing like world-class cutting-edge technology to the table. So yes, it's vagal nerve stimulators. Yes, it's using low-level laser therapies. I love working with Erconia because they have 22 FDA clearances, and I know I can trust their product because it's gone through all the clinical trials and testing to get there. We also do things like Normatec boots to help with vascularity and blood flow. We use video nystagmography for objective testing, which is putting goggles on you and like graphing out eye movements to see if they're normal or if they're abnormal. And then if they're abnormal, what can we do to help you on that side of the house? We're using all of these different like cutting edge, clinical based, really good evidence backed medical devices to help our patients. And a lot of times I send patients home with these things on the weekend. Like, I don't usually charge for it, which maybe is fine, but like, I want people to get better. And when patients do get better, like, we have so much fun. Like this woman who's in the office who hasn't had a headache in like 9 days, she's doing phenomenal. Like, her and I are having so much fun in the office, getting her better, asking questions, being like, pulling back the layers of like, what else is there? What else can we work on? What else has been an issue for you? And so there's just so many aspects that go into treating these cases. And hopefully you were able to take something away from this conversation that we just got to have. I mean, we are relentlessly looking for the best of the best of the best for nutrition, for supplements, for modalities, for treatments, doctors, providers, collaborators. And we're consistently finding that a lot of people are just consistently let down by the system as a whole. It's not necessarily just a doctor. It's the system as a whole, where you might go see your medical doctor and only get 10 minutes because that's the clinic's policy that they work at. Your doc might want to put in an hour's worth of care with you, but they can't. And so you have to understand that what's great about what we're doing is that we have the flexibility and the tools by being in private practice to kind of prioritize those things. And I think our outcomes really speak for themselves. So if you are somebody who is still struggling, if you're still looking for answers, if you're still like questioning, like, will I ever get better? I want you to know that there are people out there who want to help you. And if you are trying to figure out like what that next step looks like, well, then reach out to us. We do free consultations. We will always do free consultations. Our goal is to figure out if we think we can help you. And we'll be honest with you. I've sent so many people away that have called the office because I don't think that we can help them. Or they need 2, 3, 4 other things before they actually can come see us in the clinic to actually get started. So we're not scared to turn people away. And I think that honesty is something that is vastly needed in medicine. So I hope you enjoyed this edition of the Migraine Mentors minicast. I wanted to give you as much clinical gems and just thought processes as possible with that. And if you have any questions, then reach out to us, right? So go to theneuroconnection.com, click a link for for your consultation. We're going to answer it. We'll be there. If you're somebody who subscribes to the newsletter, thank you for supporting us. We can't thank you enough. And if you're somebody who hasn't subscribed to our newsletter, the Migraine Mentors newsletter, then what are you waiting for? The link is in the subscription below in this YouTube video. Click on it, subscribe, and we're going to be sending out more of these gems throughout the rest of our time that we're doing this. So thank you for joining me today, and I hope to hear from you soon.